My background in terms of this field of trauma-informed care or adverse childhood experiences really originated in my training as a physician in internal medicine. That was at a time before we really knew about post-traumatic stress disorder. Nobody taught me, and it wasn't being taught, that what we were really dealing with was these addictions or these behaviors that there was a reason for them, but we didn't know what it was, and it was probably the battle trauma, and probably also what we now know was probably a lot of childhood trauma, and so that the smoking and the addictions were their ways of coping, with their life experiences and the way it affected them. I wanted to do something to prevent those people from being in that situation in the first place. The alcohol abuse and the cancers, which are preventable if they're detected early. The health education model was good for a while, but for a lot of people, health education doesn't work. And I became interested in the emotional or psychological, psychiatric underpinnings of these behaviors. What are the origins of health and social problems in human populations? And you can't talk it away because it's really it's not the part of the brain that's talking. What's talking is the emotional part of the brain. Their behavior makes sense because it helps them. And so it sort of shifted from saying we need to teach people not to do this to saying let's understand why they're doing it. So we wanted to measure experience where there was some awareness, prior research, but more importantly, where there were already organizations or initiatives or prevention programs, or where there was some basis in our society where those things were being addressed to do something to prevent or treat.